Alendronate sodium, also known as alendronate, is a medication used to prevent and treat certain types of bone loss in adults, a condition known as osteoporosis. Osteoporosis causes bones to become thinner and more prone to breaking. The risk of developing osteoporosis increases with age, after menopause, or with long-term use of corticosteroid medications. This medication works by slowing down the process of bone loss, helping to maintain strong bones and reduce the risk of fractures. Alendronate belongs to a class of drugs called bisphosphonates. It is usually taken once a week, first thing in the morning, on an empty stomach with a full glass of water. After taking alendronate, you should wait at least 30 minutes before eating, drinking, or taking any other medications. This will help the body absorb the medication properly. It's important to take alendronate exactly as prescribed by your doctor to get the most benefit from it. Before starting alendronate, make sure to read the medication guide provided by your pharmacist. Take it once per week, on the same day each week, with a full glass of water on an empty stomach. Stay upright for at least 30 minutes after taking it, and do not eat or drink anything, except water, for at least 30 minutes after. Avoid taking it at bedtime or before getting up for the day. Also, avoid taking calcium or iron supplements, vitamins, antacids, coffee, tea, soda, mineral water, or calcium-enriched juices for at least 30 minutes after taking alendronate. Remember to take it regularly for the best results and talk to your doctor about the long-term benefits of taking this medication. If you experience stomach pain, constipation, diarrhea, gas, or nausea, it's important to let your doctor or pharmacist know. However, many people who use this medication do not have serious side effects. You should tell your doctor right away if you experience jaw or ear pain, swelling of joints, hands, ankles, or feet, increased or severe bone, joint, or muscle pain, new or unusual hip, thigh, or groin pain, black or tarry stools, or vomit that looks like coffee grounds. In rare cases, this medication may cause serious irritation and ulcers of the esophagus. If you notice new or worsening heartburn, chest pain, or pain or difficulty when swallowing, it's important to stop taking alendronate and talk to your doctor or pharmacist immediately. While a serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Remember to always consult your doctor for medical advice about side effects. Do not take alendronate if you are allergic to it or other bisphosphonates, or if you have certain medical conditions. Before using this medication, tell your doctor about your medical history, especially if you have disorders of the esophagus, trouble swallowing, low calcium levels, kidney problems, stomach/intestinal disorders, or if you have trouble standing or sitting upright for at least 30 minutes. Some people taking alendronate may have serious jawbone problems, so it's important to have regular dental exams and to tell your dentist that you are taking this medication. Before any surgery, including dental procedures, inform your doctor and dentist about this medication. This drug is not recommended for use in children, as they may experience severe side effects. If you are pregnant or plan to become pregnant, discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking alendronate sodium. Certain medications may affect how it works or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medications. If someone has taken too much alendronate sodium and is experiencing serious symptoms such as passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, painful heartburn, chest pain, muscle weakness or cramps, and changes in mental/mood. If you or someone you know is experiencing any of these symptoms after taking alendronate sodium, seek medical attention right away. Remember, do not share this medication with others. In addition to taking alendronate sodium, it's important to make lifestyle changes to promote healthy bones. This includes increasing weight-bearing exercise, quitting smoking, limiting alcohol, and eating well-balanced meals that contain enough calcium and vitamin D. You may also need to take calcium and vitamin D supplements. Be sure to consult your doctor for specific advice. While taking alendronate sodium, you may need to undergo lab and/or medical tests such as X-rays, height measurement, and blood mineral levels. It's important to keep all medical and lab appointments. For more details, consult your doctor. Thank you for watching. If you forget to take your alendronate sodium dose, just take it the next morning when you remember. Then continue taking it on your regular weekly schedule. Make sure not to take 2 doses on the same day. When storing alendronate sodium, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of alendronate sodium, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. Your pharmacist or local waste disposal company can provide guidance on the proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.